Doctor, please!
How can a woman not know she's pregnant?
How did I not know that this was going on in my body?
4 women.
Somebody help!
Alex, call 911.
4 shocking and unexpected pregnancies.
Out of here right now.
Is this baby even going to be born alive?
I looked down, I said, oh, mama, we're having a baby.
But how could a full-term pregnancy go unnoticed?
The pregnancy test did come back negative. I felt no movement. I had no morning sickness, no sickness at all. I mean, I felt fine.
How will these babies fare, having gone without prenatal care for 9 months? And did the mothers unknowingly risk their babies' lives?
I was told I couldn't have children.
I would not have menstrual cycles at all.
I didn't have any specific cravings.
I didn't gain anything.
She didn't look pregnant.
2006 was a year 24-year-old Jessica Kosciuszko will never forget. That year, she had been working 2 jobs and planning her wedding. She also lost her grandmother to breast cancer. So having children was the last thing on her mind.
Me and my fiance at the time did talk a lot about having children. We knew we wanted to wait probably at least a year or 2.
Jessica was on birth control for years, so when she missed her period in January, it came as a complete surprise. She took a home pregnancy test. It was negative, but Jessica wasn't convinced. She stopped taking birth control just in case she was pregnant and it might harm the baby. When she missed her period again in February, she took another pregnancy test. Once again, it came back negative.
In a normal pregnancy, certainly by the time you've missed a period, the home pregnancy test should be positive. So home pregnancy tests these days are very sensitive, though really days after implantation, those pregnancy tests can pick up the pregnancy hormone.
The 2 tests combined, and the fact that she never felt nauseous or gained any weight, convinced Jessica that there was no way she could be pregnant.
Everything that I've endured with sickness and death and trying to plan a wedding, it just weighed heavy on my mind, and obviously just hormonal, it just threw me off. So I then basically said, it's the stress.
8 months later, Jessica and her fiancé, Ben Kosciuszko, have just come home from church, where they were finalizing plans for their wedding just 2 weeks away. Jessica's periods have remained irregular, but she continues to believe it's the stress. But suddenly, Jessica is blindsided by searing abdominal pain.
I had extreme stomach problems, like I was having cramping and the diarrhea. I had started dry heaving, and I thought, oh, this is getting bad.
The sudden onset of symptoms leads Jessica to believe she has the flu, or worse yet, the same cancer that took the life of her grandmother.
Ben, help me! I got scared. I felt something down there, and I thought the worst. Automatically, I'm like, this is it. I'm dying. I have something awful wrong with me.
Ben, help me! We need to go to the hospital.
Okay.
Her fiancé, Ben, helps her to the car and races to the emergency room.
Hurry, get there, please!
We're almost there, baby.
Ben is as frightened as Jessica. He reacts to his fiancé's increasing agony by driving faster and running red lights.
He just knew that he had to get to the hospital as fast as he could, no matter what.
Before long, the police are in pursuit.
And the whole way to the hospital, I am crying and I'm telling him, you know, no matter what, I love you. He kept telling him, you have the flu. And I went, no, this is more than the flu.
Ben refuses to pull over, fully convinced that Jessica is dangerously ill.
I need you to slowly sit down.
The couple finally reaches the hospital, but Ben is detained by the police.
I was alone. The main reason for being alone was the police officer was talking to Ben.
I know, I'm so sorry.
Don't hold your breath.
By now, Jessica is certain that she's suffering the same agonizing fate as her grandmother.
I'm here, okay? I'm not going anywhere.
He said, I'm scared. And the only thing I could say was, my grandma had cancer.
Okay.
It's cancer. I know it is.
But the ER nurse can feel the unmistakable spasms of a woman in labor.
Honey, that's a contraction.
And she went, you're having a baby, and you're very close to having a baby. And I went, no, I have the flu.
Jessica Kosciuszko has now been in labor for 9 hours without even knowing it. When they try to move her to the maternity ward, Jessica still refuses to believe that she could possibly be pregnant.
I thought I had the flu. Now I'm feeling a lot of pressure down in that area. I'm not sure what's going on.
The news would also come as a shock to her parents, who also never noticed she was pregnant.
She didn't look pregnant. You know, when you're pregnant, your stomach gets big, and she did not look pregnant.
In fact, Jessica felt no symptoms that would lead her to believe she was pregnant.
I felt no movement. I had no morning sickness, no sickness at all.
We're gonna have this baby right now.
In the 9 months during my pregnancy that I wasn't aware of, I did everything normal.
Cut the cord right now.
Hang on.
Ben! Ready, one more time. Baby's coming.
I couldn't at first understand how she couldn't feel anything, because I, could feel Jessica when I was pregnant. But no, she said she didn't feel anything at all.
In spite of what most people believe, not every woman experiences the same symptoms during pregnancy.
It's really difficult to predict whether someone's pregnant based on symptoms. The symptoms that people feel when they're pregnant are so variable, especially for someone who's not been pregnant before. Feeling the movements of the baby could be attributed to gas and not realize that it's actually a baby moving inside.
And Jessica actually lost weight during her pregnancy.
She had started to lose weight, actually, because she started to take good care of herself before her wedding.
Because Jessica has had no symptoms and no weight gain, and this is her first baby, she still doesn't understand what's happening. The nurses don't have time to wait for a doctor. Jessica is already fully dilated. And the consequences of not knowing that she was pregnant for 9 months may cost the baby its life.
And they were like, "Honey, you didn't know?" And I was like, "No." So then the nurse's face, you could tell that she was scared also, not knowing how far along I was. Was it going to be a full-term baby? Was it a premature baby? They really had no clue.
Ben is still being detained by the police, and Jessica has no time to process what's happening. Terrified, she simply does what she's told.
I had nothing, no epidural, no medication whatsoever.
15 minutes after arriving at the hospital, Jessica vaginally delivers a silent baby. She watches helplessly as the nurses rush the newborn out of the room.
Where's she going with the baby?
Let's deliver your placenta now.
Scared and disoriented, a host of terrors run through Jessica's mind. Is the baby healthy? Has she harmed it? Is it even alive? Coming up.
They never said anything if it was a boy, if it was a girl, the size. I was scared to death, and I didn't hear the baby crying. I went, it was stillborn.
True or false? You can get pregnant while on the pill if you take certain other medications at the same time. True or false? You can get pregnant while on the pill if you take certain other medications at the same time. Answer: true. Certain medications, including some antibiotics and anti-seizure medicines, can interfere with your birth control pill. Jessica Kosciuszko has just had the biggest shock of her life. She has gone into labor without even knowing that she was 9 months pregnant.
Okay, get ready, one more time, come on.
Immediately after the baby is born, nurses rush out of the room with the silent infant.
Where's she going with the baby?
I was scared to death, and I didn't hear the baby crying, and I went, it was stillborn.
With no prenatal care, Jessica's baby is at risk for low birth weight, severe birth defects, or even death.
Prenatal care is something that clearly is beneficial to women who are pregnant because we are essentially screening for worst-case scenarios, which include diabetes of pregnancy, high blood pressure during pregnancy. So a high-risk woman like that who has undergone a lot of stress, prenatal care would have certainly provided a big benefit for her.
To make matters worse, Jessica works as a volunteer firefighter. In the past 9 months, she repeatedly put herself into extremely dangerous situations with strenuous physical activity.
In the 9 months I was pregnant, whenever the pager went off, I went. Structure fires, motor vehicle accidents, EMS calls. I mean, it's nonstop.
Jessica responded to a rescue call at an automobile accident when she was 8 months pregnant, where she may have put her fetus at risk.
It was the week after my bridal shower We had a bad 2-car accident where 4 people lost their life, and we did have to use the jaws of life. I mean, I was hopping, jumping over the ditches, carrying tools.
That kind of situation would cause her to have a high heart rate, high blood pressure. A worst case scenario would be death of the baby inside, so intrauterine fetal demise.
Her father, the fire chief, recalls that October day clearly.
Who's helping me cut these people out that was entrapped? It was a long extrication. Was my daughter. She's carrying the jaws of life to me, jumping over ditches.
Did Jessica's heroics result in serious consequences for her unborn baby? She had no idea. Jessica is left alone with her fears while Ben talks to the police.
Once Ben explained to them a little bit of the situation, I really don't know what's wrong with my fiance, I'm scared to death, I'm sorry, this and that. The police officer said, go on in there, buddy, you need to find out what's going on with your fiance.
Ben is finally allowed to join Jessica, shortly after the baby has been taken to be examined.
Yeah.
Then they wheeled this little bed in, and I'm like, what?
After all of the chaos and fear, Jessica and Ben finally meet the 7-pound, 8-ounce baby girl Jessica has carried 9 months without even knowing it.
Ben, he just was beaming. He was smiling from ear to ear.
Luckily, she did not smoke or drink during her pregnancy. At 19.5 inches long, Jessica's newborn is likely a full-term baby. Amazingly, she is completely healthy.
Look what you did.
I guess we have a baby.
They name her Alexis Barbara after Jessica's beloved grandmother.
We didn't have anything to bring a baby into the world. I mean, nothing at all. No clothes, nowhere for the baby to sleep, no diapers, no wipes, no onesies. We had nothing.
So Pancho and I went to the store and got the car seat. All our family and friends, everybody had went out and bought things.
2 weeks later, Ben and Jessica are married on their original wedding date. Joining them is one unexpected but very welcome guest. So how is it that Jessica didn't know she was pregnant?
I think the biggest reason I really never would have assumed I was pregnant was by taking 2 pregnancy tests and them coming out negative and really having no symptoms at all.
She did a couple of pregnancy tests that were negative when she missed her period. She may have conceived late February, so I think that her missed periods before that were due to stress.
Now 15 months old, Alexis Barbara is happy and healthy.
I just think my daughter was lucky, and I still think it's a miracle that the baby Alexis is as fine as she is.
Oh yes, I think the birth of Alexis is a miracle. She resembles my mom a lot of ways, and that's the part that's very hard. But we have my mom back.
I think that by Alexis coming into our lives, it was that ray of sunshine that we all needed.
Coming up.
Alex, call 911.
Okay.
I looked down, I said, oh, mama, we're having a baby.
True or false, you can't get pregnant during your menstrual period. True or false, you can't get pregnant during your menstrual period. Answer, false. Most women aren't likely to be fertile during their periods, but depending on when you ovulate, it's not impossible to get pregnant. Bob and Beth Hums always wanted a big family, but their first daughter Allison was a hard-won battle.
I got stuck on my math problems today.
What makes you think I know how to do them?
Beth and Bob had tried for years to have children before Beth was finally able to conceive.
Allison was a 3-year project of all kinds of medications to try to help me get pregnant.
Beth has a condition known as retroversion of the uterus, often referred to as a tilted uterus.
Having a tilted uterus can sometimes make it difficult to conceive. Just because it's tilted, that could be a reason why I had issues conceiving Allison.
finally getting pregnant was a small miracle after years of heartbreaking disappointment.
A lot of frustration over that, because I think that's one thing in your life that you feel, when I'm ready to have a child, it'll just happen. But then for us, we found out that it wasn't something that was that easy.
But once she got pregnant, she experienced many symptoms normally equated with pregnancy.
When we had Allison, she had all kinds of different cravings, and she got as big as a house.
Felt sick with Allison. I had morning sickness.
Her labor with Allison was also extremely difficult.
They kept losing Allison's heartbeat, so they didn't know what that was actually doing to her. Was she going to have any kind of brain damage, that kind of thing?
Luckily, Allison survived and thrived. But having more children seemed unlikely.
My mom always wanted to have more children, and I always wanted to have a brother or sister.
I was pretty much told by the doctors that my chances of having more children would probably be slim to none.
Does everybody have everything they need?
18 years later, Allison is starting her last year of high school, and Beth and Bob will soon be faced with an empty nest. Since Beth believed she was infertile, she stopped using birth control long ago. At 42, Beth's periods had become irregular. She thought it was the beginning of menopause, but in reality, Beth was pregnant with her second child, and no one had any idea. Beth felt none of the cravings, nausea, or weight gain she'd experienced in her previous pregnancy.
I had no morning sickness at all.
She didn't gain any weight.
If anything, I probably lost some weight.
Several factors may have contributed to Beth not knowing she was pregnant. Her retroverted uterus may have been one reason. The position of the baby may have been another.
The doctors have said that women with tilted uteruses don't always feel baby's kick or baby's movement.
If it's a breech baby, for example, and the baby is kicking more into the bladder, then the bladder is kind of preventing the baby from kicking right on the skin.
So when Beth goes into labor, it never occurs to her that her pain is related to being pregnant.
Sunday, September 11th was very normal. Usually I go to bed, I sleep all night, I'm dead until my alarm goes off. But for some reason that night I woke up.
Beth is surprised by a violent stab in her lower left side. She's in sudden, intense pain. Pain she hasn't felt since she gave birth to her daughter 18 years ago.
Double me over kind of pain.
I said, well, maybe it's your gallbladder.
Allison! Allie! Call 911!
Okay.
Go! Go!
Something's wrong with my mom.
The 911 operator dispatches paramedics.
So lie down on the floor. She needs to be on her back. What now?
It is Bob who then makes the shocking discovery.
I looked down, I said, oh, mama. I said, we're having a baby.
Head coming out.
We were both shocked. There was nothing we could do.
Beth is about to deliver her second child, and she never had a clue that she was pregnant.
There's a head coming and...
Allison continues to relay information to 911, but Bob has no medical training, and judging from Beth's grueling first pregnancy, things could quickly take a turn for the worse. Delivering the baby at home with no doctor present is endangering both mother and child. Her first birth was a cesarean. Under normal circumstances, doctors would have automatically ordered a C-section for her second birth as well.
So if you've had a C-section and you're pregnant again, if you have a vaginal delivery, there is the risk of uterine rupture.
The paramedics still haven't arrived, and the baby is now crowning. The situation is getting more serious by the second.
Yeah, I was a little scared.
As the baby's head begins to show, Bob almost makes a fatal mistake.
Should I just push the baby back in?
Right before I was ready to push the baby back up, the person on the other line said,
Dad, whatever you do, don't push the baby back in, just let the baby come.
There's no time to wait for the paramedics. There on the bathroom floor, Bob Hums delivers his second child himself.
well, I was kind of like sitting there like somebody hiking the ball to me, ready to take a football.
Breathe, push, push.
One more pain and this little thing was in his arms.
The newborn still hasn't made a sound, and the cord is still attached. With no medical training, they have done as much as they know how to do.
Go, go.
The paramedics arrive just in time.
She's right in here.
All right, how are we doing? Wait till the foot.
They clear the airway, and the baby finally cries. They cut the cord, and the paramedics prepare Beth and the baby for transport to the hospital. So how is it that Beth thought she was menopausal when she was actually pregnant?
I think that's the big misconception, is people feel that you can't get pregnant once you start entering that perimenopausal period, when in fact, all you need to get pregnant is you need to ovulate, you need an egg that's chromosomally normal, and you need a sperm that will fertilize the egg normally.
Even looking back, like I'll think, did I have a pain that I should have thought was something else, or a backache? But I really probably felt as good then as I felt throughout the rest of my life.
Even though Beth did not smoke or drink during her pregnancy, not knowing she was pregnant could have had dire consequences.
I do think back and think, what if something would have gone wrong? We could be in a whole different place now, but thank goodness that everything came out the way it did.
Baby girl Natalie Elizabeth Hums weighs in at 4 pounds 12 ounces. Her initial examination reveals that she may be 4 weeks premature.
So she was extremely tiny. Her lungs were developed, so she didn't have to spend any extra time in the hospital at all.
I really, truly think she's a miracle.
Cook the eggs. Push the buttons.
Today, Natalie is a healthy toddler and a happy addition to the Hums family tree.
Done yet? Please come out so they can play with you. Oh, Mr. Sun.
Coming up.
Felt like something was ripping from my body. This cannot be happening.
True or false, home pregnancy tests can detect a pregnancy even before you miss your period. True or false, home pregnancy tests can detect a pregnancy even before you miss your period. Answer, true. Some home pregnancy tests can detect a pregnancy several days before your period is due. 35-year-old Nicole Davis Burris has been with her boyfriend Kevin Barnett for 8 years, and the two were ready to start a family.
Been taking that medicine the doctor gave you?
Yeah, I've been taking my medicine.
Nicole suffers from high blood pressure and obesity, which has resulted in virtually non-existent menstrual cycles.
They would come and go, and then all of a sudden it just stopped. So I didn't have one for like 14 to 15 years.
Because of her obesity, lack of menstrual cycles, and high blood pressure, doctors have told Nicole she probably won't be able to have children. Believing she was infertile, Nicole stopped using birth control.
When I was told that I was unable to have children, I was kind of upset.
Hoping to control her obesity and high blood pressure, she went on a crash diet without a doctor's supervision and lost 30 pounds. Ironically, it is most likely this dramatic weight loss that made it possible for her to conceive.
She told me she had lost about 30 pounds, and that may have been enough to trigger an ovulation.
But when Nicole is suddenly hit with a barrage of symptoms, including lower back pain, chronic fatigue, and relentless gut-wrenching nausea, it never occurs to her that she's pregnant. Instead, Nicole thinks she's menopausal.
I thought I was going through a change of life at an early age due to the hot flashes, cold flashes, the sweats. I thought I was going through an early stage of menopause.
Nicole has seen countless doctors to get treated for everything from menopause to thyroid issues, but even the doctors are stumped. And because she hasn't had a menstrual cycle in over 14 years, no one even considers she could be pregnant.
I could barely walk, and I was in so much pain that I thought it was like a virus or something, because my back and everything was bothering me. I didn't know if I ate something bad.
Did you take to the doctor or anything?
Nicole's boyfriend, Kevin Barnett, is extremely worried.
I was getting real scared. We called our doctors and set up appointments, and they said everything seemed to be fine.
Ironically, when she experiences spotting, common with pregnancy, she mistakes it for a menstrual cycle.
And it was like a bunch of blood, like I had a menstrual, but it wasn't normal.
That night, Nicole's symptoms are worse than ever. As the pain and nausea sharpens, she feels moisture under the sheets. She is terrified to discover a gush of more bloody discharge.
So I called the on-call physician, and she said that it didn't seem like it was emergency.
By the next morning, the symptoms intensify. They're now coupled with excruciating back pain. In spite of the pain, Nicole is determined to pick up her mother and take her to her weekly dialysis appointment. But when Nicole gets there, she's too weak to drive. Her mother insists that Nicole go to the emergency room. By the time they arrive at the hospital, Nicole's pain is unbearable.
My mother got me in a wheelchair, and that's where everything took off.
Mama, you go to dialysis. Oh, I don't want to leave the baby.
Nicole's mother is reluctant to leave her daughter's side.
Go on ahead and we'll take good care. I'll be right back.
The ER team runs a standard panel of blood and urine tests. The results take Nicole completely by surprise.
She said, Nicole, you're expecting, you're pregnant.
Pregnant?
And I'm thinking, well, if pregnancy is like this, and I have 9 months, how is this gonna work out? Because I was in so much pain. And then so she said, oh, it'll be all right. You just look like you have like a infection or a virus or something.
Although the ER staff is certain she's pregnant, they haven't had enough time to determine how far along she is, and they have no idea she's in labor.
On a scale of 1 to 10, my pain was a 10. I just had a sensation that I had to go to the bathroom.
She stumbles into the hospital restroom, hoping for some relief.
I didn't know what was going on. I just started screaming.
She yells for help as a surge of pain moves through her body. She feels something pass, but the pain is still unbearable.
I felt like something was ripping from my body.
Nurse, help me.
But Nicole is still in excruciating pain.
Stood over the sink, and then this one nurse came in and got scared and ran out. So then that made me scared.
The ER team rushes in and immediately tells Nicole to leave the room.
They didn't want me to look.
Inside the toilet bowl, a tiny baby boy is floating lifelessly. The umbilical cord has detached and is still inside Nicole. Without knowing it, Nicole has just given birth to a son, and his fragile life is hanging in the balance. Coming up, while her newborn son fights for his life, the doctors will make a shocking discovery that no one could have prepared for.
Almost there.
True or false? Once you enter perimenopause, you can no longer get pregnant. True or false? Once you enter perimenopause, you can no longer get pregnant. Answer: false. All you need is one viable egg and sperm to fertilize it. Nicole Davis Burris had no idea that she was pregnant. She has just given birth to a baby boy in the toilet of an Ohio emergency room, and the umbilical cord has detached and is still inside her. But she's still in pain and has no idea what's happening to her.
In reality, it was the baby coming down into the birth canal, pressing on her bowel, and so the baby delivered.
Her 2-pound, 14-ounce baby boy is floating in the toilet, and he's not moving. The new mother is rushed away from the horrifying scene as the ER team revives the baby in the neonatal intensive care unit. Nicole still doesn't know she's just delivered a child.
And they didn't tell me until after I got on the bed. They said, you just had a son, and he's in the toilet, and we have to revive him. I said, well, how is he doing? And everyone said, we don't know right now. They're trying to get him to breathe.
Nicole's baby could be in serious jeopardy. Her lack of prenatal care combined with her high blood pressure and obesity are looming concerns for the hospital staff.
No prenatal care. She had some high blood pressure problems and some other medical conditions.
What's her blood pressure?
165/98.
But the baby isn't the only life on the line. Nicole is facing serious consequences from her surprise delivery.
The obstetricians were very concerned because her blood pressure was high. That's a problem called preeclampsia. If their blood pressure gets real high, they can have a seizure.
A seizure could lead to a coma and even death. doctors in the neonatal intensive care unit fight to save her baby boy's life, while another team moves swiftly to work on Nicole.
Oh, that's my baby. Can't worry about that right now, Nicole. You have to focus.
The only cure for preeclampsia is complete delivery, which includes the placenta, and Nicole's placenta is still inside her.
When the resident examined her to pull the cord, usually you just give gentle traction on that cord and the placenta will separate and come out, and it didn't. And so the resident realized something else is going on here.
What's going on? There's another baby. Another baby!
2 babies. I said, this cannot be happening. You just told me I was pregnant, and it's not been 9 months yet. I was just mind blown. I know, I was like, oh Lord, I hope my baby's safe. Please be with him.
There's another baby.
Another baby.
Push. You need to push as hard as you can, Nicole, okay?
But with Nicole's risk of preeclampsia, both she and her second child's life are in danger. Preeclampsia affects the blood supply to the placenta. If the placenta doesn't get adequate blood, the baby may not get enough oxygen, which can lead to a stillbirth. Nicole needs to push now if this baby is going to make it.
I never had an upper dural. I didn't get any of that. I guess I didn't have time for nothing.
It's a girl.
Within minutes, Nicole gives birth to Kira Barnett. She is a tiny 2 pounds 11 ounces, but healthy and alert upon arrival. Because of her size and prematurity, she joins her brother Kieran in the neonatal intensive care unit. The doctors estimate the twins are at 30 weeks, missing 2 months of critical in vitro development.
A normal length of a pregnancy would be 40 weeks, and I believe these babies were given an estimated gestational age of 30 4/7 week. We would like to see our twins get a little further.
In the meantime, a confused Kevin arrives at the hospital. The last thing he heard was that Nicole's situation was critical. He has no idea that she's given birth, let alone to twins.
Show you where she is.
And they walking me down to the room, they were saying to themselves, like, he don't know. So I'm trying to put 2 and 2 together, like, I don't know. I'm thinking there's something serious. So when I get in the room, they tell me, congratulations, you was a new father.
Well, that's why I was so sick.
I can't believe it.
I asked him to pinch me to see if it was real. The best moment was when I was able to see my twins together.
Can't wait to hold them.
It's been less than 2 hours since Nicole arrived at the hospital. When Nicole's mother returns from her dialysis, she's absolutely stunned at what has transpired.
I said, yes, Mom, it's true. I had a boy and a girl.
Can you believe it?
If it weren't for her mother's dialysis appointment, Nicole may not have made it to the hospital, and the day could have ended in tragedy.
I think Nicole was very lucky to have 2 healthy babies out of this experience. She was lucky she was at a hospital when she delivered, so there were a lot of lucky things.
Be okay. I love you.
So how is it that Nicole didn't know she was pregnant?
I was told I couldn't have children and I hadn't had a menstrual, and I thought you had to have a menstrual in order to conceive. I didn't have any symptoms or cravings. Matter of fact, I was losing my appetite, no movement.
If you have an anterior placenta, it's a big, thick pad that connects to the cord, and if that placenta is in front, it's more padding, and so some patients do not feel the baby kicking as well.
After 3 weeks in the hospital, the twins' prematurity still makes them vulnerable to health concerns.
We didn't have anything to start with. We didn't have a bottle, we didn't have a diaper, but everything seemed to work out right.
I'm blessed that they're here now, but it was a total surprise. I call them my miracle babies. I know my singing sucks, but he loves it. Sleepy time, go to sleep.
Coming up.
I just couldn't imagine being in that much pain and coming out of it. I thought I was gonna die.
True or false? If you ovulate 3 days after having unprotected sex, you can get pregnant. True or false? If you ovulate 3 days after having unprotected sex, you can get pregnant. Answer: true. Sperm can live for 2 to 3 days in your birth canal, waiting for an egg to fertilize. After 5 years of marriage, Jennifer and Dan West weren't ready to start a family.
That was honestly the furthest thing from either of our minds at that point in our lives.
In fact, Jennifer had been on birth control pills for several years.
I was on the pill, and I actually had a bout of strep throat in September of '04, and I was on antibiotics, and I wasn't aware, and no one told me that if you're on antibiotics that the pill is less effective.
Since she didn't use a backup form of birth control, Jennifer would conceive a few weeks later without even knowing it. Her menstrual cycles had always been irregular, and they remained so for the 9 months of her pregnancy.
During the 9 months, my menstrual cycles were all over the place, really intermittent, and they were pretty light periods, but I'd have the cramping and all the other kind of symptoms I would have associated with it.
She had had several episodes of vaginal bleeding during the pregnancy that she attributed to her normal periods.
And surprisingly, she never felt any fetal movement at all.
There's certainly a fair degree of variation there. Some babies don't move as much. Some are much more active than others.
Jennifer also had none of the cravings associated with pregnancy.
I didn't have any nausea. I didn't have any specific cravings for anything.
Although Jennifer gained a few pounds, no one gave it much thought.
With her weight gain, I just never equated it to being anything other than just being not very active or not a very healthy eater.
9 months later, Dan and Jennifer were planning to spend a relaxing 4th of July weekend at their fishing cabin in Hayward, Wisconsin. But as they settle in for the night, Jennifer is paralyzed by excruciating cramps and violent lower back pain. It's the same agony she felt years ago when she was diagnosed with a fibroid tumor in her uterus.
I started feeling that same uneasy feeling in my stomach where I felt this cramping and this pressure.
She had it treated non-surgically and thought all was well. Now, Jennifer is secretly terrified the tumor may be back. Dan gives his wife a pain reliever. It helps Jennifer get through the night.
Did you sleep last night?
Not much.
But the next morning, the pain is back, and it gets progressively worse as the day goes on.
I really wasn't feeling well. I just felt like I was coming down with the flu or something.
Jennifer doesn't want to ruin the vacation, so she insists Dan go out and enjoy the day.
And in that time, I went from feeling bad to feeling horrible. I literally thought, I might die in this cabin.
Dan returns a few hours later to check on his wife.
She was literally almost doubled over in pain.
That's it. I'm taking you to the hospital.
No.
How are we doing?
No, it hurts.
Dan races his wife to the nearest emergency room.
It seemed like the longest car ride of my life.
Be inside. Fine, I'll park the car.
While Dan parks the car, Jennifer is in extreme pain.
I just couldn't imagine being in that much pain and coming out of it. I thought I was gonna die.
Jennifer describes her backache and how her stomach cramps are coming in consistent waves, prompting the triage nurse to ask what seems like an obvious question.
Are you pregnant?
And I said, well, no, and I'm having my period.
Despite Jennifer's certainty, the nurses perform an ultrasound to be sure.
A little pressure here, sweetie.
Bringing a new life into the world couldn't be further from Jennifer's mind.
I was thinking I had this, huge tumor. I had something that was causing so much physical pain that it was going to kill me.
Jennifer is braced for the worst news of her life, but is shocked back into reality by the sound emanating from the ultrasound machine.
All of a sudden, we heard this goosh, 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 goosh. And, I was just like thinking, what is that?
You're gonna have a baby.
I just looked at her and I said, that's just not possible.
The life inside of her is the cause of her sudden and mysterious pains.
And so at that time, then I think Dan was sitting right outside and he didn't really hear what was going on. But a nurse came out and said, do you hear that sound? And it was that goosh, goosh, goosh. She said, that's your baby's heartbeat. And Dan said, you must have the wrong guy. There's another woman behind that curtain, and that can't be my wife because she came in with a backache.